Hi, welcome to the Medical Center Show. I'm Joe Scott, President and CEO of Jersey City Medical Center, Barnabas Health. And with me today is one of our new interventional cardiologists, Dr. Znamensky. We'll be right back.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in 10 high-rise rental towers with amenities such as the on-site Newport Path subway, light rail and ferry service, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Sears, JCPenney, Macy's, and Target. Morton Williams Supermarket is just outside your front door. A health and fitness club, spa, skating rink, and medical facilities are also on site. NewportNJ.com. Enjoy the New York skyline from Newport Town Square. Manhattan is just one path stop away or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Want to visit Newport? Stay at the Westin or Marriott Hotel. Go to NewportNJ.com for details. Newport has luxurious towers, great restaurants, shopping, New York skyline views, schools, playgrounds, a marina and yacht club, gym, spa, fine wine, fine living. It's incredible. It's you. NewportNJ.com. Newport, live like you want.
Seeing the ER doctor at the Jersey City Medical Center has never been easier. If you're sick, you just click. Go to libertyhealth.org, and here's how it works. Click Skip the Wait. Select your time and check in now. Enter your symptoms, your personal information. Click Proceed to Confirmation, and the doctor's waiting for you. The Jersey City Medical Center. Make Hudson County's #1 hospital your first choice. Jersey City Medical Center, Hudson County's #1 hospital, as ranked by the U.S. News and World Report. Why? Because of its patient care, not its bottom line. Jersey City Medical Center, for patients, not for profit. The Jersey City Medical Center accepts all patients and most insurance. At the Jersey City Medical Center, your health is our concern, not our bottom line. Make Hudson County's #1 hospital your first choice. The Jersey City Medical Center, for patients, not for profit. Visit us on the web at libertyhealth.org.
Welcome back. I'm here today with one of our brand new interventional cardiologists at Jersey City Medical Center, Dr. Znamensky. Dr. Znamensky, tell us a little bit about yourself. You came to us about 3 or 4 months ago?
I started July
In July,
1st.
Okay. Time flies. Seems like you just got here.
Yes.
Tell us about your training and where were you before you came to the medical center?
I trained in Brooklyn, my mother's medical center.
Oh, you did? That's a big hospital, right?
It's a big hospital, about 800 beds.
Oh, wow.
Big cardiac center. A lot of firsts in my Maimonides, first heart transplant, and a lot of pioneering work in interventional cardiology as well.
Wow, so you've got a really broad base of experience that
Yes.
you can bring to the medical center. That's
Yes.
great. And so you do interventional cardiology. There's a bunch of different types of cardiologists out there. Tell us a little bit about why you're a little bit different than, like, say, a general cardiologist.
Sure. Interventional cardiologists do special procedures. They do cardiac catheterization and interventions. Generally, patients come in with occlusions in the coronary arteries around the heart.
Okay.
We use small catheters that we insert into vessels, bring it to the heart, insert into vessels around the heart, do diagnostic imaging, injecting contrast material, check for blockages, and open up those blockages with special balloons and stents.
Oh, I see. So you actually are the guy who kind of, when somebody's having a heart attack, we get the patient right to the cath lab, and you're the guy who's going to be there to really save that patient's life, right?
Yes, we do. We have a special program at Jersey City Medical Center.
Right.
Code HEART,
Right.
or ST elevation myocardial infarction, or what people call it.
So tell people what that means, because that's the real catchword, right? ST elevation, myocardial infarction? Yeah.
Right. Basically, it's the heart attack.
Okay.
Patients come in via ambulance, we receive notification, and in the ER, Jersey Medical Center, ER physicians contact one of us, whoever is on call. We get the electrocardiogram, we take a look at it, and we decide whether this is a true heart attack, ST elevation MI, and we come in. At that point, we have about half an hour to get to the hospital. So it's really requires a lot of concerted effort on parts of everybody.
And the standard of care is to get that heart attack patient to the cath lab within?
Within 30 minutes
Right.
and 90 minutes to open up that artery.
Oh, to open it up.
Yeah.
So when you say open it up, it closes because there's a clot there? Is that usually what happens?
It's usually ruptured plaque. It's
okay.
usually plaque that's been developing due to atherosclerotic disease. It's what we eat and what we do, and genes.
We'll talk a little bit about that at the end. But,
Sure.
but right now there's plaque that kind of breaks away.
It breaks away, closes the vessel 100%. There's no flow in the vessel.
So it
and
stops the blood flow to the heart, to a portion of the heart?
to the portion of heart, to the heart muscle.
Wow.
And the name of the game is to save that heart muscle.
Right. So once the blood flow stops to that portion of the heart, if you open that up within a certain period of time, does the muscle will be saved then? Is that
There's a much better chance for the muscle to sort of be revascularized or
Right.
to reestablish blood flow to the muscle and to survive, to go back to a normal function.
Now, you know, we were talking a little bit earlier, we just were ranked the #1 hospital in New Jersey for cardiac care from Comparion. I think a lot of that has to do with our EMS service. You know, they are kind of like boots on the ground, know right away when somebody's having a heart attack. They start communicating that to everybody, and we really get people to the cath lab within that 90-minute time frame, right?
Absolutely, yes.
Yeah.
I think it's being #1 in New Jersey.
Right.
It's really effort on part of everybody, not
Right.
just people in the cath lab. It's people in the ER, people out in the field like EMS.
Right.
And I always encourage them. I always tell them, if you have any doubt, this is a heart attack, call it. We'll respond. Bring it to us. We'll know what to do.
We'll know exactly what
Yeah.
to do. So once the patient gets to the cath lab, so they'll come through the emergency department. There's a group of doctors that then evaluate that patient.
ER physicians
Uh-huh.
evaluate the patient. They communicate with us.
Right.
They send us the electrocardiogram. We usually are already on the way because they tell us
Right.
ahead of the time. Then the patient is prepared, brought to the cardiac cath lab with physicians, making sure that the patient is okay. We come into the cath lab, interventional cardiologist, nurses, technician, and we start the procedure.
So there's a whole team, even in the middle of the night that happens, right?
2 o'clock in the morning,
2
6
o'clock
o'clock
in the morning?
doesn't matter.
So do you get tired all the time from
It becomes a way of life, and
Yeah.
you know.
But to be obviously you have to get here within a certain period of time.
30
So
minutes.
there's that whole adrenaline thing that goes
No
along with
time.
that,
You just
right?
have to get up, get dressed, and
Right.
get going.
Right. And so we have a team of cath lab people also that's available to save that patient's life also?
There is a team. There are 2 nurses, a technician. Everybody's on call. They know when they get that phone call, they have to be here within 30 minutes.
You know, I was just looking at those statistics. Our mortality rate, meaning the number of people that die from heart attack at our hospital, is only 1.5%. It's like 10 times better than the national average. I mean, I think it's that
incredible.
team effort,
It's
right?
incredible.
I mean,
Absolutely.
it's the ER doc, it's the people in the cath lab, the interventional cardiologist who all kind of work together to get that patient up to the cath lab within that 90-minute time frame, get them open within 90 minutes, right?
Yes, and those patients tend to be very, very sick.
Oh, they do?
Yes, because it's a process. It's an inflammatory process that takes place in not just in that vessel, but in the entire body. So those patients tend to be sick, and even after we open up those arteries, sometimes they can be even sicker afterwards due to reperfusion, due to reestablished blood flow. That's just the way physiology works. But we clearly do a good job.
Yeah, and you know, you've got some great experience over at Maimonides because they were really cutting edge, right?
Yes,
And so you're going to bring some new techniques to our hospital.
absolutely.
But before we talk about that, and we're going to talk about that in our next segment, but so once the patient gets cleared, well, what's their clinical course like? Do they usually go home in a couple days, or?
They usually go home about 3-4 days, but
Uh-huh.
first they go to cardiac ICU.
Right,
That's another place, the Jersey City Medical Center, which is excellent.
Right.
Nursing care, the ICU is excellent. Doctors 24/7 taking care of patients.
right,
Depending on their course of the disease, depending on the way things are at the end of the procedure, they go to cardiac ICU, they're monitored, they receive medications, and they usually stay 3-4 days.
they
in the
stay 3 or
hospital.
4
Yeah.
days after that.
If there are no complications.
And then when they go home, I mean, they can start running a marathon again, or is there a process?
So
that
what
they
I
need to
tell
really go through?
patients usually, what we do is just half of what needs to be done.
Okay.
The rest is really up to them
Up to
because
them, right.
it's really life-changing experience.
Right.
Heart attack is a life-changing experience, and they really have to change their life, their habits, their diet, whatever they do, whether they're smokers
Right.
or food that they eat. Genetics are hard to change,
Right.
but we can try to beat it by trying to stay healthy, positive, and do the best we can.
All right, great. Listen, we're going to talk a little bit about that new procedure you're bringing to the medical center and kind of how that was going to really help patients, and we'll be right back.
It takes more than a state-of-the-art medical facility to make a great hospital. It takes a team of dedicated medical professionals. That's the Jersey City Medical Center, Hudson County's #1 hospital. Medical teams consisting of New Jersey's top doctors, Magnet Award-winning nurses, and accomplished hospital associates, all committed to your good health. That's what you have at the Jersey City Medical Center. Make Hudson County's #1 hospital your first choice. The Jersey City Medical Center. On the web at libertyhealth.org.
Panapinto Properties, Jersey City. Shaping the workplace with state-of-the-art office space and an address your company desires. Building residences that define your home environment. Adjacent to all modes of transportation. On-site parking available. The right address, the right lease. 201-521-9000 or visit on the web at panapintoproperties.com. Panapinto Properties, building Jersey City for everyone.
Welcome back to the Medical Center Show. We're here with Dr. Znamensky talking about cardiac care. Dr. Znamensky is one of our brand new interventional cardiologists. So we're talking a little bit about getting patients to the hospital, you know, the whole 90 minutes to open up their heart again. You know, there's communication, though, from the very second that EMS picks up that patient, right? They start talking to the hospital right away.
Start talking to ER, yes.
Wow,
ER
so that
physicians.
really does help with that turnaround time and getting people to the to the cath lab within that 90 minutes, right?
Absolutely.
Yeah, that's really terrific. That whole team approach makes a big, big difference. So you trained at Maimonides, and they really are a comprehensive center with some cutting-edge cardiology services. I mean, you'd mentioned that they're one of the first to do heart transplant. One of the procedures that you bring to us is the radial approach
Yes.
for cardiac catheterization. So tell us a little bit about what that means and what it means for patients.
Well, as we talked about, cardiac catheterization or coronary angiogram is a procedure where we bring small catheters into blood vessels around the heart, take diagnostic pictures, decide on whether there are blockages. Sometimes it could be one vessel that is affected. It could be more than one vessel that is affected. Then we
Okay.
bring cardiac surgery into the game.
So we're going to talk a little bit about cardiac surgery after this. So there's times when you can't fix the patient with the catheters and you have to bring the surgeon
There are times
in.
we can't and probably shouldn't
Right.
fix patients and have a discussion with the patient, of course, and with the
Right.
cardiac surgeon regarding their further care.
Right.
So traditionally, this procedure, coronary angiogram, was done through the groin.
So they would put a catheter actually in somebody's leg?
In the groin,
Take
there's
it all
a
the-
femoral artery,
Right.
Numb it up with some lidocaine, just like what dentist or any sort of local anesthetic
Right.
does. Small puncture, go through femoral artery, that goes to aorta, up across the aortic root into the heart. And
So
that
from
was
here all the way up to here?
all the way
So
into
how
the
do you
heart.
do that? I mean, there's special equipment, obviously.
There's special equipment, there are special wires that sort of prevent any traumatic event that can occur from a catheter, bringing across the aorta, placing around opening to coronary arteries around the heart.
So how do you feel when you're kind of threading that? I mean, does it become routine? It's got to be
becomes
it's
routine, but I
something
think-
very, very special that people like you know how to do, right?
I love it, so
Do
every
you?
time is special to me, and
Right.
every time I remember, since it's sort of been not too long for me,
Right.
I always remember the time when I first decided that I want to be an interventional cardiologist. So I
Right.
always remember that time, almost every time I
Wow,
see a
that's
patient.
great. That's good.
So this was the traditional way, going through femoral artery.
Mm-hmm.
Radial approach, and radial artery, it's a small artery in the wrist. It's not new. Actually, the radial approach has been used about 20, 25 years ago.
Okay.
But at the time, it was cumbersome. Equipment was not as good. People tried it, and some people stuck to it and actually have been doing it for the past 20 years. The Japanese are very, very good at it, and they've developed a lot of technology that we use today. And a lot of equipment that we use comes from Japan. But the radial approach sort of picked up in the past 5 to 10 years. And the Europeans did a lot of research related to radial approach. And the data that is coming out today and came out in the past 5 years, that radial approach is safer for patients.
Oh.
There are fewer bleeding complications because femoral approach in the groin is a lot of soft tissue. Sometimes the needle
So it's
puncture.
here versus here, right?
Right. So
Yeah.
it's groin versus actually the wrist.
Right.
A lot of soft tissue in the groin. A puncture from a needle may not be exact.
Right.
And there may be some bleeding that may not be apparent right away or in the beginning of the case or at the end of the case and further complicate things later.
Is that why
after the
they
case.
put those weights on people sometimes after the...
Right, so we either hold it manually. There are closure devices available today and
Right.
it sort of makes things easier. Traditionally, we used to either hold it manually or put weights on the, groin. Radial approach eliminates a lot of these complications, bleeding complications, because it's a much smaller area, what is called compressible.
Right.
We can manage complications related to extravasation or oozing of the blood, if you will, around the enterocyte.
Plus, it's a shorter distance to your heart, right?
It's sort of shorter distance. It's a little bit cumbersome for cardiologists. So there is a steep learning curve.
Oh, there is.
And it's interesting. I've talked to a lot of cardiologists. So the newer breed of cardiologists, you know, we used to do where I trained about 70–80% of our cases through the radial artery. And it took some time to convert people to the, you know,
right.
to think about it as, you know, attempt radial first. And there are cardiologists in this country who are advocating that radial should be the first site to access in the patient.
Wow.
Of course, carefully selected patients, because
Sure.
not everybody. For instance, I always emphasize to the Cath lab staff that patients that undergo dialysis, I generally don't like to go to radial arteries because I try to save their site for future dialysis access.
Right. So there are some exclusions.
Sure, absolutely.
Not every patient should
not
get
every
the radial.
patient, right.
Right.
So it's a patient by patient, but
Right.
the latest data regarding radial approach is great. Fewer bleeding complications. Financially, it makes sense for hospitals because there is research available today saying that hospitals save money on radial approach because fewer complications, shorter stay, et cetera, that leads to sort of financial benefits to organization. Furthermore, heart attacks, what we talked about, Europeans actually put in their guidelines today that heart attacks should be treated through radial approach because patients that having heart attacks and they have radial approach, they have actually decreased mortality or fewer of them die later on in the course of their heart attack or later with the radial approach versus femoral approach.
And why is that? Is it?
It's the same. It's related to bleeding complications because when patients come in with a heart attack, we use a lot of medications to thin out their blood.
Right.
So that alone makes
so you're
their
thinning their
risk.
blood, you're puncturing a hole, and you got a whole
Exactly.
bunch of complications associated with that. And when you do it in the arm, you don't have that as much.
Exactly. So learning curve is steep.
Right.
It's possible to do. It's possible to learn.
Right.
It takes a little bit of a getting used to. Perseverance, but in experienced hands, it could be a very good procedure. And I've had so many patients at Jersey City Medical Center already who had femoral procedures before, and now they came in and they saw me and I did it through Reese, and they were really surprised how easy it is, and within a couple of hours.
So the
they would go home.
patients even feel better about it.
Yes,
and
absolutely.
they get out of the hospital that much
yes,
quicker.
patient satisfaction has been studied with the radial approach,
Wow.
and it's actually matters a lot.
Wow. We'll be right back. We're going to talk a little bit more about interventional cardiology, and we'll be right back.
Jersey City Medical Center consistently receives the highest hospital ranking and ratings in New Jersey. #1 overall hospital in the state, #1 for high-risk pregnancy, #1 for neurological disorders, #1 for stroke, Magnet Award for nursing excellence, A for hospital safety. What makes the Jersey City Medical Center the #1 hospital in the state? Top-rated, award-winning medical professionals you can see today at the Jersey City Medical Center. Make the #1 hospital your first choice, the Jersey City Medical Center. Jersey City Medical Center, Hudson County's #1 hospital, as ranked by U.S. News and World Report. Hudson County's only hospital to receive an A safety score rating. Jersey City Medical Center is Hudson County's only hospital to receive the prestigious Magnet Award for nursing excellence. Make the #1 hospital in Hudson County your first choice for quality health care. Jersey City Medical Center. Visit us on the web at libertyhealth.org.
Welcome back. We're here with Dr. Znamensky, who is one of our brand new interventional cardiologists at Jersey City Medical Center, bringing some new technology and new techniques to our hospital. We're so glad that you're part of our medical staff. You really made a big difference in a very short period of time.
It's great to be here.
Yeah, we're talking about this radial approach and patient satisfaction. Tell us a little bit more. It's funny that you say that patients who've had one procedure one way, then they have this radial approach, they're so much more satisfied.
It's great because even if, well, diagnostic case is fairly straightforward, and at the end of a procedure we apply this special band. It's called Radial band, which is basically a piece of plastic with some air balloon inflated over the radial site to hold some pressure. And we usually remove it 2 hours if it's a diagnostic case, and if it's intervention, I remove it within 3 to 4 hours.
Right.
And patients actually have been going home the same day of a procedure.
Wow.
So
that
that's
really
great.
makes a big difference
Absolutely.
for people. I mean, and like you talk about, patient satisfaction. Look, we're here to take care of everybody, but the sooner we can get them out of the hospital, the better it is for everybody.
The better it is for everybody,
right?
yeah.
And then how about, you said that there's fewer complications from the radial approach versus using the groin. How about their course afterwards? Do you think that patients kind of recover quicker? And
They recover quicker.
Right.
They're able to stand up and walk much quicker than after femoral procedure. Look, radial is not for everybody.
Right.
Sometimes it works in about 90% of patients that are selected for radial procedures. Sometimes I cannot predict what their vasculature is like once I go up the arm, and it may be the turns and the curves of the arteries are quite difficult to negotiate, and I may abandon procedure in the middle of the procedure and say, you know what, I need to switch.
But you have to make that clinical decision.
Yeah, absolutely.
Right.
But at the end, when it's all done and the radial band is applied, patients can get up and walk to the bathroom.
Yeah.
Which is a big difference.
That's a big deal.
Yeah.
That really is a big deal. So at the medical center, we're putting in some new Cath labs. I think we're excited about this new technology, right? I mean, tell us a little bit about, so one Cath lab is actually under renovation right now.
One Cath lab is under renovation right now, and that's room number 1, we call it, which is going to have some incredible capabilities. Not only is it going to be capable of doing radial procedures, and for radial procedures it's just how we maneuver our equipment, but it's also going to be capable to do peripheral vascular procedures, and I also do peripheral vascular procedures as well.
So explain for people when you say peripheral vascular.
Sure.
You're doing things like opening up clots in the legs?
Blockages in the legs, yes. Wow. So coronary artery disease, peripheral vascular disease, they're sort of like sister and brother, or two brothers or two sisters. They're related. Patients who smoke, patients who are diabetic, patients that have extensive atherosclerotic or coronary artery disease, they tend to have peripheral vascular disease. And those are patients who come in with complaints of pain when they walk, pain that subsides after a block or two of walking, and then they start walking again. That's a pain. Those are your typical symptoms of peripheral vascular disease. And of course, there are various degrees of peripheral vascular disease. Generally, we send those patients for non-invasive testing first. We do measure pressures in the arm and in the legs, and sort of see the difference, if there is difference in blood pressures. We send them for ultrasound. I personally prefer physiologic testing first, because that tells me really about the extent of the disease, presence and the extent of the disease. And if it's significant, we take them for a peripheral angiogram. So there is coronary angiogram, there is peripheral angiogram. It's usually done through the groin, although I've done procedures even at Jersey City Medical Center through the wrist, looking at peripheral vasculature. It's just having a very long catheter coming through the arm all the way down to the legs. And those are procedures that we do.
And after you kind of do that procedure, so the patients feel better right away? I mean,
they usually have almost immediate symptomatic relief.
Wow.
Most important for patients with peripheral vascular disease is, as we say, quit smoking and start walking. That's very important. Exercising and sort of getting over those symptoms, and exercising, taking medications, controlling their diabetes, controlling their lipid profile, very important.
Yeah, I think I saw an article about, being sedentary, sitting there in a chair for long periods of time is just as bad as smoking cigarettes. So,
absolutely.
If you're at work and you're sitting all day, get up and walk around your office. And in fact, I find myself doing that every once in a while, right?
Sure, yeah. Don't we
good.
all?
So our new cath labs will have that capability.
Absolutely. It's
And
gonna
so
have-
we've got one brand new one that we're working on now.
The second one is going to be on the way.
Right.
And that's going to be a cath lab capable of doing electrophysiologic procedures
Wow.
for our colleagues who are electrophysiologists, people
Right.
that deal with pacemakers and defibrillators and ablations.
Right. So that's the other kind of part of cardiology.
That's the
So we
other
have
part of
interventional cardiology, we have
Yeah.
kind of general cardiologists, and those guys that deal
Yes.
with the electrical conductivity of the heart. They're called electrophysiologists,
Yes.
right? Yeah. But you have a pretty good team that all work together depending upon what the patient needs.
Excellent.
Yeah.
Excellent team.
We talked a little bit about open heart surgery. We're
Mhm.
the only open heart surgery hospital in Hudson County. So if you're in the cath lab and you see that you really can't fix the patient doing what you do through
Right.
interventional, tell us, so you work closely with our chief of
Very
cardiac
closely.
surgery?
Yes, Dr. Krause. If we need their input, if we need their help, even to go over the case and sort of give
Get
an
a
idea
second
of what-
opinion.
Yeah, second opinion. What do they think? Whether it's something that can be done in the cath lab or should be done in the operating room. Very easily, readily available to speak with. We work very, very closely. I've sent many patients already to them, and they're very easy to get hold of and sort
Right.
of talk to about cases.
And other hospitals don't have open heart surgeons. I mean, in Hudson County, we're the only one.
Yes, other hospitals don't have open heart surgery, which makes things more difficult, especially hospitals that do primary PCI or they treat heart attacks.
Right.
Having open heart surgery is sort of gives you that,
Confidence that
confidence
you can
that
do something right away.
Absolutely.
You don't have to worry about if something goes wrong, transferring the patient to another hospital.
Yes, because complications do occur.
Right.
Patients can be a lot sicker than what we think initially.
Right.
And you take the first diagnostic shot sometimes to say,
Yeah.
oh my God, this is a patient who needs to go for surgery right now.
Right. So that really is a major advantage for Jersey City
Huge
Medical
advantage,
Center.
yes.
We're so happy you joined our staff. Dr. Znamensky is a doctor here in Jersey City. He's part of Total Cardiology Care. We'll be putting some information about how you can reach him. He's a great young new addition to our hospital, and I know he's going to bring a lot of great things, new innovations, using the radial approach. I think that's a great, great thing for our hospital and for patients, of course. So
Of course.
thank you so much for being here with us today, and we welcome you to our medical staff and glad you're part of our team.
Thank you for having me.
Okay. We will be back next week, and we'll be talking with one of our internal medicine doctors, Dr. Park.
Seeing the ER doctor at the Jersey City Medical Center has never been easier. If you're sick, you just click. Go to libertyhealth.org, and here's how it works. Click Skip the Wait. Select your time and check in now. Enter your symptoms, your personal information. Click Proceed to Confirmation, and the doctor's waiting for you. The Jersey City Medical Center. Make Hudson County's #1 hospital your first choice.